Hello, welcome to our PowerPoint presentation entitled Enhancing the Rural Response to Sexual Assault. My name is Ian Dobson and I'm a family physician currently practicing in Mackenzie, British Columbia. And with me is Lisa Creelman, a nurse practitioner also from Mackenzie. This presentation is related to a micro-project funded by the Northern Interior Rural Division of Family Practice. This project came about as Lisa and I both identified discomfort among providers at our site in providing adequate care for patients who have suffered a sexual assault. I personally often felt overwhelmed in being able to deliver adequate medical, psychological, and forensic care to these patients while also being responsible for staffing the rest of the emergency department at the same time. I'd like to begin our presentation by discussing some disclosures. The first one is that there are currently provincial efforts underway to improve rural approach to sexual assault. Our presentation isn't meant to replace those efforts, but instead offers some interim support to our Mackenzie and other division colleagues in providing care to this specialized population. Our presentation and our project was specifically designed for Mackenzie, and this project may need some alterations to fit the needs of other rural communities, and I would like you to do so as you see fit. This presentation is also specific to people over 13 years of age. If you're dealing with a pediatric sexual assault, it would likely be beneficial to contact your local pediatrician or sexual assault team. We also can't ensure that the contents of the binder and the presentation that we present will remain up to date and current at the time that you're using it. Today's date is June 20th, 2019, and we can say that it is up to date as of today. So this project of ours consists of three components. The first component, which has been distributed to several division sites, is a small tote container which has equipment that we think would be useful for sexual assaults. This slide contains a picture of the tote that we have in Mackenzie. As well, there's also an overview of the kit contents. We have provided some of these kits to division sites, and if you haven't already received one, unfortunately it's unlikely that we'll be able to make one for you. Therefore, if you do have the resources and you think it would be useful, we would encourage you to do so. The second component is a binder, which you can see in the top left corner of our tote kit. The binder is entitled Sexual Assault Reference Binder. This is a compilation of resources put together by Lisa that serve as a reference for the medical, psychological, and forensic care of the patient. I will be going through this binder in detail shortly. The next few slides relate to the Sexual Assault Reference Binder. The binder has been distributed to most sites. If you haven't received one and are interested in doing so, please contact our division administration. So this is the first page that is contained within the Sexual Assault Reference Binder. It is a sexual assault care checklist. I won't review it in detail here as it's easy to read through, and hopefully you have it in front of you right now. It essentially provides a step-by-step approach to providing care for patients, including what to do when arriving at the hospital, meeting the patient, performing a physical examination, packaging of evidence, completing the case, and it also has an overview of medically appropriate orders. The next section of the kit provides an overview of the RCMP forensic collection paperwork. Lisa will review this in detail in her PowerPoint presentation. This section essentially provides you an overview of what to expect when a patient chooses to have forensic collection done. There is lots of paperwork contained within the RCMP kit, and this will review it. It also provides a step-by-step approach of how to fill out appropriate documentation. The next section of the binder has resources that Lisa compiled to use when a patient decides to have medical care only and does not wish to have RCMP forensic collection kit completed. Lisa will explain the various options that patients can face during her presentation, so I won't get into this in depth. The next section includes some medical order sets from Northern Health. Examples of what would be included in these order sets include ordering appropriate blood work, antibiotics for STI prophylaxis, options for Plan B if pregnancy is possible, and options for HIV and hepatitis prophylaxis. There is also information on a strangulation assessment and a medical approach to injuries suffered from this mechanism of injury. It's important to please note that the current information within these order sets may not be up to date if you're viewing them in a few years from now. We're hoping that having these order sets available brings to your attention that this is an important part of the care, and that you should more or less just be aware that there are order sets available. Likely the more up-to-date ones will be present on the Northern Health website. The next two sections of the kit outline protocols and procedures taken from the BC Women's Hospital website. They may be useful to help assist you in the care of your patient, and I would encourage you to review them. The third component of our project is the following PowerPoint presentation, which will outline the rural response to sexual assault and serve as an educational reference. Please note that Lisa's PowerPoint expands on pertinent points, while the binder and checklist is meant to consolidate that information into an easy reference.
Thank you, Dr. Dobson. Objectives for this PowerPoint are to review what is a sexual assault and what are the elements of consent, what is our role as healthcare providers and what are options for care, review of history and physical, forensic sample collection, chain of custody, and packaging of evidence, as well as follow-up care. So before we start going through a sexual assault examination, we first need to define sexual assault and implications for consent. Sexual assault is essentially defined as any form of sexual activity forced upon another person without their consent. This can include kissing, touching, fondling, frottage, which is rubbing, forcing to watch pornography, and the list goes on. Interestingly, it was only in 1983 that the Criminal Code recognized that sexual assault includes all unwanted acts and that penetration does not have to occur, and a spouse can be charged with sexually assaulting their partner. Furthermore, previous sexual history and character of the person reporting the sexual assault cannot be routinely examined in an open court nowadays. There are 3 levels of sexual assault according to the Criminal Code of Canada. These do not necessarily have any bearing on your examination per se, but it's good to have an idea of what these levels are, as sometimes it can help to provide you with more information. Level 1 sexual assaults are any form of sexual activity forced upon another person without that person's consent, and there are typically no signs of physical injury or abuse. Level 2 sexual assaults involve a weapon, threat to a third party, or violence causing bodily harm. And level 3 sexual assaults are often called aggravated sexual assaults and usually occurs when a person is wounded, maimed, disfigured, brutally beaten, or the person was endangered during the assault. Children is the next component to review, looking at the elements of consent. So regarding children who present reporting sexual assault, there are definitely some legislative pieces to consider. The first one is the Infants Act. Within BC, there is no set age when a child is considered capable of giving consent. What that means is that healthcare providers can accept consent from a child for medical treatment without getting consent from a parent or guardian if the child is able to demonstrate the need for treatment, what that treatment involves, and the risks and benefits of having the treatment versus not having the treatment. So together, these elements encompass evaluation for competency and ensuring the patient is informed. The next step in the consent process is ensuring that their consent is provided voluntarily. Remember, for the purposes of this presentation, we are discussing children who are 13 years of age and older presenting for sexual assault. Furthermore, it's important to note that there is no requirement to inform parents or guardians if the child is 13 years of age and older and does not want them involved. Their privacy is covered by the Freedom of Information and Protection of Privacy Act. However, there are some caveats to reporting requirements, as we will see on the next slide. So as mentioned on the previous slide, the Freedom of Information and Protection of Privacy Act protects patients by preventing public bodies from inappropriately using or releasing personal information. In our case, we are considered a public body as healthcare providers, and as such must only disclose personal information without the patient's permission in accordance with sections 33.1 and 33.2. These sections outline circumstances where the concern for the child's welfare or public welfare supersedes the privacy of the child, similarly as seen with concerns for suicidal or homicidal ideation. The Child, Family and Community Services Act is another piece of legislation that indicates that any case of sexual, physical, emotional abuse, neglect, or exploitation should be reported to the Ministry of Children and Family Department. Furthermore, there are guidelines within the Criminal Code of Canada that indicate that medical personnel must report sexual activity to Child Protective Services if there is an assault of a child less than 12 years of age, assault of a child 12 to 13 years of age by someone greater than 2 years, even if that encounter was consensual, assault of a child 14 to 15 years of age by someone greater than 5 years, even if consensual, assault of a child under the age of minority by a family member or person in authority, or the assault of any person receiving care or support from service providers such as in hospital or nursing homes. If you have any questions with regard to whether or not you have a duty to report in any circumstance, options include discussing this further without any identifiers to your local Ministry of Children and Family worker. I also recommend obtaining advice from your protective agencies such as CMPA for physicians and CNPS for nurses and nurse practitioners. Within Northern Health, the Prince George Sexual Assault Service and the BC Women's Sexual Assault Service in Vancouver are on call 24/7 and available for case consultations and guidance. So as a healthcare provider, it is not my role to try and prove or disprove whether or not a person has been sexually assaulted. Instead, our approach remains focused on the medical perspective of care for this patient. We are concerned about ensuring that the patient is safe, that they are receiving the appropriate medical care and treatments, that we provide at the time of the assault and afterwards access for follow-up psychological care as needed, that we help patients access various health care and support services that support their recovery process, and that we provide forensic care where applicable, and we ensure that adequate follow-up care is arranged. There are 4 options for care for persons presenting with the report of sexual assault. The first option is medical care only, where we provide medical treatment and ensure appropriate follow-up care for patients who present but do not want police involvement or evidence collection. The second option is for medical care, a forensic examination, and forensic sample collection for storage. This, unfortunately, is not an option that we have available within Mackenzie. However, we do review that this is an option and that it is available within Prince George, and those interested parties will travel there for these services. The third option is medical care, forensic examination, forensic sample collection, and police involvement. There is also a fourth option that we do not currently have available here in Mackenzie, but we are trying to have access to this, and it's called third-party reporting. This is where we can either do medical care only, or if they travel to PG, they can do medical care, collection of evidence, and storage of that evidence. But instead of making a report directly to police, persons can go to a supportive organization, such as the ones listed here, to complete an anonymous report that goes to the police. Sometimes this is a beneficial option for patients who do not want to file an official report, but are able to alert the police of the circumstances surrounding their assault. Now we will examine the documentation available within the RCMP kits. So this is an example of a documentation package for evidence collection and police involvement. Within this manila envelope, you will find the Healthcare Practitioner's Guide that helps guide providers in completing a sexual assault examination with forensic evidence collection. There are consent forms. There are sexual assault history and interview forms, a forensic evidence record, traumograms, item labels for the forensic samples that have been collected, and there are also kit reference number labels that go on the evidence envelopes as well as the paperwork. And finally, there are also security labels for when you are sealing evidence after transferring to police. With regard to the sexual assault interview and history, there are 2 forms that are utilized. This first form has open-ended questions on it that allow patients to present their story without interruptions. Some clarifying information that we may need to ask afterwards includes the nature of the assault related to the healthcare needs for the patient, the mechanism of injury, possible sites of DNA for evidence collection, activities that occurred since the assault, the time, location, and position the patient was in at the time of the assault, as well as the possibility of drug and alcohol involvement. This is the second form, which is also found within the binder. It is important to review gynecological history, such as contraceptive use, last menstrual period, hysterectomy or recent cervical procedures, or if the patient is currently pregnant. It is important to collect relevant medical history, such as past medical history, medications, and allergies. However, we have to be cautious not to document any of these on the forensic forms themselves unless they are relevant. For example, Coumadin would be relevant medication to include on the forensic record, as it may have an impact on the severity or presentation of particular injury we might find. This is an example of a strangulation assessment form. It includes common symptoms and accompanying traumograms to document the physical findings. These particular forms are not found within the RCMP kit. They are Northern Health specific and can be ordered through DocuSource. There are examples of these within the medical care only documentation within your kits. So this is an example of the Northern Health Forensic and Medical Care Documentation Package. Often this documentation package is used instead of the paperwork within the RCMP kit. Within our site, our providers found this was an additional confusion, and as such, we now utilize it as paperwork for our patients who present requesting medical care only. It allows us to still collect the pertinent data related to the needs of the patient while still gathering the appropriate forensic information should patients decide they would like to report in the future, as there is no statute of limitations on reporting sexual assault. The paperwork within this package is similar to that found within the RCMP kits. However, it also includes the strangulation assessment forms and the regional lab and medication order sets. And we're just going to pause for a quick second here.
Just keep talking, or should she?
Okay, and we are back, and we're going to review the physical forensic examination general principles. So a few tips. Ensure to clean your exam area with a bleach preparation. Sometimes you will have to purchase these bleach wipes separately, as with accreditation in most sites, they no longer carry bleach preparations, period. Confirm consent for the examinations. Ensure that you have appropriate documentation and supplies with you, such as traumograms, measuring tapes, gloves, sterile water. There are RCMP sexual evidence kits, the toxicology kit if drug and alcohol was suspected, gowns, and blankets. Ensure to wear gloves during the examination and change those gloves after exposure to any body fluids and as needed to prevent cross-contamination. And remind the patient that they can stop at any time during the examination as needed. Quite often it can be quite nerve-wracking to complete a forensic examination on a patient, but we also have to remember that the patient is our priority and needs to be treated with care and consideration to prevent re-traumatization. If possible, the patient should not eat or drink before oral swabs are collected. They should also not void or defecate before the physical examination and evidence collection. However, sometimes this may not be possible. If they need to void, collect voided urine in a sterile container and refrain from wiping the genital or anal area. If they have to wipe, collect the toilet paper as a sample if it's the first voiding after the incident. For best practice, collect the evidence as applied in the order in the RCMP Healthcare Provider's Guide, with the exception of ensuring we complete the anal rectal examination before the genital vaginal examination as possible. If we complete the genital vaginal examinations first, sometimes you may get drainage of any fluids from that area to the anal area, and it may cause site cross-contamination. So this is a slide about using an alternate light source. This is not something that we advocate for unless you have been appropriately trained in using an alternate light source, as there is a complicated science behind its use and variations in techniques depending on each type of light source. However, some general information is that it can sometimes be used to facilitate localization of area of fluorescence and also foreign material. Usually it is used with a darkened room, and you manually hold the alternate light source approximately 15 to 20 centimeters from the skin. However, this can vary depending on what type of light source you're using. Typically, we will examine from head to toe for the presence of stains and augmented patterned injuries, such as bite marks, which can sometimes fluoresce. It can also be utilized to examine clothing. The caveat is that sometimes alternate light sources can also highlight common medical presentations such as atopic dermatitis and psoriasis and so on. When collecting evidence, we often utilize swabs in doing so, and we'll often use both wet and dry swabs. Wet swabs utilize one swab to collect evidence from dry areas. We moisten half the swab with sterile water and then swab the area with the damp side, then turn the swab over and swab the same area on the dry side. Examples of areas where we would use a wet swab include clothing stains, deposits, prolonged skinned contact, dried blood or dirt stains, bite marks, or other areas where there might have been saliva deposit, fingernail swabs, and in the external genitalia. Dry swabs are utilized to collect evidence from a moist area, so we remove two swabs and hold them together and then swab as directed based on the sample site. Areas where we would use these swabs include oral, vaginal, and or rectal cavities. So these are examples of traumograms that are available within the RCMP kit. There is also a legend available on the very first page that gives you abbreviations for particular findings, such as abrasions or lacerations. So moving on to the physical examination. The first step in the physical examination is examination of the clothing. With the patient's consent, we always want to collect the underwear. If there is a sanitary napkin present, it can be left on the underwear and packaged together. Collect any relevant articles of clothing if worn during or immediately following the assault. Ensure that you are descriptive with documentation of items and findings, as well as the location of any tears or stains or other debris that may be found on the articles of clothing. Moving on to the head-to-toe examination, a full body examination is recommended with an additional focus on specific body areas based on the assault history. Furthermore, inspect the areas following in further detail as dictated by the history. For example, the head and neck will be thoroughly examined if there's a history of strangulation or head injury. Examination of the mouth if there's a history of oral contact and or penetration, attempted strangulation, or trauma to the face. Examination of the genitals and or anal or rectal area if there's a history of oral contact or some type of penetration, as well as examination of the skin and limbs, especially if there's a history of restraint and or physical contact to these areas. Ensure to document any physical exam findings on the accompanying traumograms. Detail that should be included includes the anatomical location of the injury. Sometimes measurement of the injury from the nearest fixed physical feature is helpful. The type of injury, descriptors, and the patient's comments about the injury and verbalizations of pain and discomfort. Collect oral samples if indicated by the history using dry swabs. Rub the swabs thoroughly along the gum and teeth margins, as well as behind the molars and in front of the cheeks. You will see exams of the swabs in the pictures before and after collection here for examples on how to complete. Collect any foreign material found on the body or clothing and place in a container, ensuring it's properly closed and labeled and packaged appropriately. So here are some examples of the before and after of packaging. Collect any body stains samples utilizing a wet swab technique as previously described. Ensure it's appropriately labeled with stickers found within the RCMP collection kit and packaged as directed. The next step is collection of fingernail swabs if indicated by the history. There is a separate special appointed swab for both the right hand and the left one. So be cautious to ensure when you're collecting the swabs from underneath the fingernails that you are keeping track of which swab was collected from which hand. These are wet swabs. Ensure to label and package as directed. If the history indicates that there's trauma and there's a jagged piece of nail missing, it is acceptable to take a clipping of the nail, keeping that piece of jagged area intact. This is done in case a piece of nail is found by police to see if it matches up with the sample that was collected. And on to the genital examination. So as mentioned previously, if indicated, complete the anorectal examination prior to doing the vaginal examination to prevent cross-contamination. Ensure you inspected the anal area while documenting the position of the exam and any injuries and abnormalities on the traumagram. Anal swabs, if indicated, are collected with wet swabs. As previously mentioned, ensure that these swabs are collected before the vaginal swabs, and label and package as directed. You can see examples again here within the presentation. Rectal swabs are collected using dry swabs, similar to previously described, with examples here for your viewing. The next step in the examination is the external genital examination. It's important to note the anatomy of the female external genitalia when documenting. Be sure to inspect the external genital area and document any injuries or abnormalities on the traumagram. Similar to the female examination, familiarity with proper terms of anatomy for documentation of the male exam is important. Similarly, inspect the external genital area and document any injuries or abnormalities on the traumagram. Next step is examination process with the pubic hair combings. These are RCMP kits no longer advocate plucking genital hairs for samples. As you can see in this picture, there is a comb with a cotton within its prongs to be able to trap any foreign debris or loose hairs. Once the samples have been collected, the comb is returned to the plastic bag and put in the envelope for packaging. Ensure prior to sealing envelopes that appropriate labeling has been completed. There is also a step that includes other items, and it has an evidence collection bag, and this is for samples such as tampons or condoms that can be frozen. These are placed within the plastic bag and sealed with the appropriate information documented on the bag itself. There is also a label that can be affixed to this bag, and then it is packaged within the envelopes as described in the instructions. External genital samples are collected using the wet swab technique. Samples are collected along the labia majora, labia minora, and any surrounding areas that are relevant. Labeling and packaging are similar to previous samples collected. The internal examination is completed if indicated by the history and includes inspection of the hymen if there is one present, inspection of the inner vaginal vault and cervical area with the use of a speculum, and ensure to document any injuries or abnormalities on the traumagram. Vaginal samples are collected for forensic purposes during the exam. These are dry swabs, and they are labeled and packaged as directed. And then the last swab to be collected within the forensic examination is the DNA reference sample. This is to collect the patient's DNA, so the patient's DNA sample can be eliminated from any forensic samples that have been collected. When collecting the DNA sample, this is a dry swab. Prior to using the swab, have the patient thoroughly rinse their mouth out with water twice before collecting the sample. The swab is typically brushed vigorously along the inside of the buccal cavity. Ensure to label and package as previously described. This is an example of a strangulation assessment card and recommendations for medical radiographic evaluation of an adult that has had non-fatal strangulation. This was developed by the Louisville Police Department and has recommendations for management. These assessment and recommendation forms are included within the reference binder. This is the Northern Health Medical Lab testing and treatment order set that we utilize here in Mackenzie. Lab testing and treatment considerations are dependent on the history. Common testing includes testing for pregnancy, sexually transmitted infections such as syphilis, hepatitis C, and HIV. We often do not test for chlamydia or gonorrhea as we are prophylactically treating. Depending on the varying treatment types, for example, in cases that need HIV prophylaxis, some baseline laboratory testing and ongoing monitoring may be required. Standard treatments that are history dependent might include Plan B for pregnancy prevention, antibiotics for chlamydia and gonorrhea, and in some circumstances, HIV prophylaxis. There are criteria available on the order set for indication on treatment with HIV prophylaxis. And if you have any questions, St. Paul's HIV Pharmacy or infectious disease specialists can provide more guidance. Forensic lab testing is completed in cases of alcohol and drug intoxication or in events where there is loss of memory. This is often completed prior to the physical examination in order to collect samples at the time closest to the event. The RCMP have toxicology kit that can be used for this collection. If they do not have a kit available, 2 gray top tubes for a total of 20 mils can be utilized. The hospital protocols for toxicology are not to be used for forensic purposes. Ensure that you're present when the lab technician is collecting the samples, as both yourself and the lab technician are required to sign the labels and the time that the samples were collected. The samples will remain with the healthcare provider for chain of custody purposes. As a note, be sure the lab uses betadine solution to cleanse, as alcohol may interfere with the sample. If the patient is allergic to betadine, cleansing with sterile normal saline can be utilized instead. This is an example of the forensic evidence record and transfer to police form. When transferring evidence to the police officer, the evidence is reviewed prior to putting it into the box and sealing it for transfer. This form allows both the healthcare provider and the police officer to check off the items being transferred and require both the healthcare provider and the police officer to sign at the bottom of the form. Be sure when documenting on the form that you're being as detailed as possible with the items that are in there. For example, if a piece of evidence is the patient's underwear, you should say black underwear, dried stain to gusset, if of course there was one there. This provides the forensic lab with information regarding what type of evidence may be available within the kits. When discharging the patient, ensure that there is a plan in place for the patient to follow up with a physician or nurse practitioner. And if possible, at time of discharge, have a plan for counseling for the patient if they consent. Provide the patient with written information about the care that they received in hospital, and if possible, provide resource package to the patient and review the items available within your specific community. We developed resource packages here specific to Mackenzie. Therefore, it was not included in the package provided within our kit. Within the binder that we created here in Mackenzie, there is also a copy of a letter for primary care providers and how to approach the follow-up care appointments with patients who have reported sexual assault. First and foremost, the priority is to ensure the patient's mental and physical health needs are assessed and ensure that any further medical treatments or referrals are initiated. Such referrals might include social worker, victim services, counseling, and other available community resources. Ensure that you review any lab tests that were completed within the hospital, as often results are not available at the time of discharge. Consider a repeat urine beta-HCG if the patient did not receive Plan B while in hospital or they have not yet had their menses. Ensure follow-up treatments as needed, as well as follow-up lab investigations. There is a program available that can provide some financial assistance to persons who have experienced violent crimes. It is available through the Crime Victims Assistance Program and is only available to persons who have reported to police. This program offers benefits that may include medical or dental expenses, prescription drug expenses, lost employment income, repair or replacement of damaged or destroyed property such as eyeglasses or clothing, protective measures, and in some cases disability benefits, services, or equipment. These application packages can be completed online, or you can order pamphlets for completion in office. The web address is available on the sheet within the binders, or you can access them by typing in Crime Victims Assistance Program BC in a Google search. So this is the end of our presentation. As Dr. Ian Dobson mentioned, this presentation provides some basic information and a point of reference for sexual assaults that are occurring within rural and remote locations. As mentioned previously, provincial and regional efforts are in progress to develop standardized approaches. And this presentation was compiled to help care providers in the interim in performing these investigations. We strongly recommend that if you have any questions or concerns about how to proceed in an examination, that you contact a sexual assault program for further guidance. We are not content experts and instead try to bridge a learning gap within our community. Within Mackenzie, we often will consult with Prince George Sexual Assault Service or BC Women's Sexual Assault Service for guidance as needed. Thank you very much for your time listening today. I hope this presentation was helpful.